Respiratory syncytial virus, RSV, is a common virus that infects the lungs and respiratory tract. Most children are infected with RSV by the age of 2. RSV is the leading cause of infant hospitalization in the United States. RSV season in the United States typically lasts from November to March, but may vary in other parts of the country. Adults can also be infected with RSV, but symptoms are typically mild and resemble the common cold. RSV can cause severe infections in infants under 12 months, older adults, people with heart and lung conditions, and individuals with weakened immune systems. Pathophysiology. RSV is a single-stranded RNA virus classified under the family Pneumoviridae, genus Orthopneumovirus. The virus is named for the syncytia, or large multinucleated cells, it forms when infected cells fuse. There are two RSV subtypes, A and B, categorized based on the reactivity of two surface proteins, F and G, to monoclonal antibodies. Both subtypes can circulate simultaneously during outbreaks, though subtype A is usually more common. Transmission occurs through contact with respiratory droplets from an infected person coughing or sneezing, or contact with surfaces contaminated with the virus. RSV can survive on surfaces like doorknobs and countertops for several hours and on skin for up to 25 minutes. After entering the body through the nose, mouth, or eyes, RSV infects the epithelial cells lining the upper and lower airways. The virus replicates in the bronchial cells for about 8 days. Infected cells become rounded and eventually shed into the lower airways, potentially spreading the virus to the lungs. The inflammatory response to the infection leads to edema, increased mucus production, and necrosis of epithelial cells. The accumulation of slough cells, mucus, and inflammatory cells causes airway obstruction, which is especially dangerous for infants and young children who have smaller airways. RSV reinfection is common throughout life because the virus can evade the immune system and prevent the development of long-lasting immunity. Adults typically experience milder symptoms upon reinfection, but infants and young children may develop more severe lower respiratory tract illnesses. Clinical presentation. In infants and young children, RSV often starts with common cold symptoms like a runny nose, congestion, cough, and low-grade fever. However, it can progress to more severe conditions such as bronchiolitis or pneumonia. Adults typically experience milder symptoms resembling a common cold. However, older adults and those with compromised immune systems may develop more severe symptoms and complications. Patients who have received hematopoietic stem cell transplants, intensive chemotherapy, or lung transplants are particularly vulnerable to serious complications, including death. Signs of severe RSV infection include tachypnea, wheezing, difficulty breathing, chest wall retractions, grunting, poor feeding, and cyanosis. Complications include pneumonia, respiratory distress, acute exacerbations of existing heart or lung conditions, and death. Diagnosis. While mild cases are often diagnosed based on clinical presentation, laboratory tests can confirm RSV infection. These include antigen tests, which detect viral proteins, and molecular tests like PCR, which identify viral genetic material. In some cases, chest X-rays may be used to assess the extent of lung involvement. Antigen testing may yield false positive results outside of peak RSV season. Molecular testing, such as PCR, is highly sensitive and specific, even in individuals with low viral loads, but is more expensive. Viral culture is useful for genetic analysis and antiviral susceptibility testing, but is less commonly used in clinical settings due to the longer turnaround time. Management. Treatment for RSV is primarily supportive, focusing on relieving symptoms and preventing complications. This may include monitoring breathing, providing oxygen therapy, clearing airways of mucus, and ensuring proper hydration. In severe cases, mechanical ventilation may be necessary. While antiviral medications like ribavirin are sometimes used in hospitalized or immunocompromised patients, their use is controversial due to limited evidence of effectiveness and potential side effects. Other treatments include bronchodilators and corticosteroids. Antibiotics are not effective against viral infections and are only used if a secondary bacterial infection is suspected. Prevention. Prevention is key in managing RSV. Good hygiene practices, such as frequent hand washing, covering coughs and sneezes, and avoiding close contact with sick individuals, can help reduce transmission. Recently approved RSV vaccines are available for adults aged 60 and older and pregnant individuals to protect their infants. For high-risk infants, immunoprophylaxis with monoclonal antibodies like palivizumab or nirsevimab can provide protection during RSV season. Immunoprophylaxis with a monoclonal antibody, palivizumab, can be administered monthly during RSV season to prevent severe infection in high-risk infants. Another antibody, nirsevimab, has been approved for prevention in newborns and infants during their first RSV season and requires only one dose. Prognosis. Most people with RSV infection recover fully within 1 to 2 weeks. Infants and young children, particularly those with underlying health conditions, are at increased risk for complications, including recurrent wheezing, asthma, and pneumonia. Older adults and immunocompromised individuals are more likely to experience severe disease, hospitalization, and death from RSV infection. It's crucial for these high-risk groups to receive prompt medical attention if RSV is suspected. By understanding RSV, recognizing its symptoms, and taking preventive measures, we can better protect ourselves and our loved ones from this common but potentially serious respiratory virus.
Question number 1. Which of the following is not a sign of severe RSV infection? The correct answer is D. Signs of severe RSV infection include tachypnea, wheezing, difficulty breathing, chest wall retractions, grunting, poor feeding, and cyanosis. Question number 2. Which medication is sometimes used in hospitalized or immunocompromised patients with RSV, despite controversial effectiveness? The correct answer is C. Ribavirin is sometimes used in hospitalized or immunocompromised patients, though its use is controversial due to limited evidence of effectiveness and potential side effects.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.